When the only constant in life is change, you need to be ready. This is the Man-Made Survival Show.
Hello everybody, my name is Jose Prado, Man-Made Survival, and thank you so much for coming back to the channel. Thank you for watching this video because this information is very important, especially all the information that has come out over the weekend. It's just insane. And I don't know if they're just waiting for the weekend in order to tell people what's going on because they either know they're not paying attention or they're too busy, or it's just happened to happen, during the weekend. I mean, I don't know. But the point is that you must be ready for anything that happens. It's a good thing that we had a heads up, but next time we may not. Here's the official numbers for the coronavirus. There's 111,356 infected with 3,892 dead. Out of that number, 8,100 from South Korea. Italy has 7,375. Iran, 7,161. France, 1,209. Germany, 1,151, and the United States, 566, which possibly that number is a lot greater, but we don't know right now. Because the very simple reason is that they have not tested anyone. And when they start actually testing people like they're supposed to, or they should, even though they said they are not, we'll see those numbers jump a lot. And especially what we're going to talk about right now, now that I read the headline. But here we're going to start with The Guardian. Leaked coronavirus plan to quarantine 60 million people sparks chaos in Italy. Italy experienced its highest day-on-day rise in death from coronavirus on Sunday and was plunged into chaos after details of a plan to quarantine more than 16 million people were leaked to the press, sending thousands into panic as they try to flee. And that's just a prelude of what could happen here in the United States. We're seeing in real time how people react. We're seeing in real time how the government reacts. And this is the data that you need right now for you to make plans ahead in the future. Whether it's a coronavirus, whether it's, a nuclear attack, whether it's an EMP, whatever, your scenario is. The point is that if they're acting like this now, they're gonna act the same way later. Sending thousands into panic, and of course the government did not let them go anywhere. They didn't. They stopped them, make them go back. And like I said, even Russia, they're saying if you violate your quarantine, you get 5 years prison. And I've heard that the Russian prisons aren't very nice. So I have a video here. This is from Fox News. It says, Fauci says anything is possible when asked about the widespread of coronavirus quarantine. Here's that video.
Seattle. Yeah. So, Italy just announced that it is going to lock down an entire region of northern Italy that includes Milan and Venice with a quarter of the population, millions of people. Nobody's going to be allowed, except under extraordinary circumstances, to go in or to go out.
Right.
Could that happen here?
We have to be realistic. I don't think it would be as draconian as nobody in and nobody out, but there'll be, if we continue to get cases like this, particularly at the community level, there will be what we call mitigation, where you'll have to do essentially social distancing, keep people out of crowded places, take a look at seriousness. Do you really need to travel? Those kinds of things. And I think it's particularly important among the most vulnerable. And that's the thing that the CDC and the State Department are going to be making some recommendations about how people who have underlying conditions, those are the most vulnerable ones, particularly elderly with underlying conditions, heart disease, chronic lung disease, diabetes, to do right now, not wait, but right now, to sort of take a look at things that are at high risk, crowded places, getting on airplanes, and absolutely don't get on a cruise ship.
So I want to press this question, though, of Italy.
Right.
Could you see a situation, a lot of talk about Seattle and what's going on there, where a city is shut down or a state or a region is shut down, and you basically just say, and in the case of Italy, it's till April 3rd, nobody in, nobody out.
It's possible. I think what you need to do on real-time basis, and that's the reason why we evaluate it literally every single day. You know, you don't want to alarm people, but given the spread we see, you know, anything is possible, and that's the reason why we've got to be prepared to take whatever action is appropriate to contain and mitigate the outbreak.
Okay.
All right, so you heard the guy, right? Anything is possible. Well, the same thing. I'm sure there's the same thing that they told the people in Italy. Anything is possible. Don't worry about it. You're gonna be all right. Oh yeah, by the way, 60 million people are quarantined, and that sent people into chaos. And I'm wondering why they went into chaos. Is it because they do not want to be quarantined, or because they know that they're gonna run out of supplies? They don't have enough supplies. They look around and say, "Oh crap, the pantry is empty. Oh crap, we don't have any water. Oh crap, we don't have anything, you know. We should just get out of here." And, you know, some people tried. I'm sure maybe one or two did get out, but as far as I've read, they're not letting anybody in. They're not letting anybody out. And as you heard, you know, Mr. Fauci, he said that they might not take those draconian measures, but they're more than likely they will. I mean, they're going to have to do the same thing, especially what's coming out of New York, and especially this headline that I have next. U.S. hospitals are preparing for 96 million coronavirus infections and nearly 500,000 deaths. It's a leaked document, or a leaked document revealed. This from the Daily Mail, but also Business Insider has the same information. So this is not a conspiracy theory or anything like that. This started the mainstream news, and this document leaked out, and, you know, now everybody wants it. Almost 500,000, which would be 480,000 people, Americans, right? Almost 500,000 Americans are expected to die from coronavirus. So all the BS that the Trump administration through Pence has said, don't worry about it. The average American don't need to worry about it. To me, sounds like BS. 500 million people are pretty close to it. Americans die from coronavirus. I thought it was just the flu. What? 4.8 million will be hospitalized and 96 million infected. So that leaves a bunch of people out of the hospital. Figures come from leaked slides from a presentation by Dr. James Lawler, a University of Nebraska Medical Center professor and hosted by AHA. They showed the spread of the deadly disease could be far worse than officials claim, with the crisis 10 times greater than a severe flu season. The shock figures fly in the face of claims made by President Trump, who has maintained on many occasions that the risk to the American people is low. Lawler estimated people with heart conditions have 1 in 10 chances of dying from the disease, compared to less than 1 in 100 among healthy individuals. Trump signed a spending bill to allocate $8.3 billion to tackle this crisis on Friday. U.S. has more than 430 cases, which now, like I said, is 466, and 19 confirmed deaths. I think it went up to 25, but don't hold me on that one because I'm not sure. After Florida confirms first 2 deaths on Friday. All right. So you heard that. It's a leaked document that they say that they want people or the hospitals to get ready for 96 million people infected, with 480,000 Americans dead from coronavirus. It's 10 times worse than the severe flu season. All right. So I hope that you saw the video that I made on how to quarantine your home, because that video is going to be very important. It's going to save your life. Because if you have any suspicion of the coronavirus and you have elderly in your home, you're going to want to quarantine them. If you have kids in the home, you want to quarantine them. And if you have a healthy person that can go back and forth, then you're going to be able to, take care of your family. I have a checklist, it's free, that you can get in the link below, of all the things you need, if you could possibly even find them anymore. All right. So I have a video. And I'm gonna end with this. It's from Governor Cuomo from New York, and he had a lot to say. And the questions that were asked to him, for once, that were not softball questions. They were actually pretty good questions, and the answers should really open up your eyes. If you're still denying, or not denying, but if you're still in denial that this is just the flu, then I hope that it doesn't get to you, because if it does get to you and it's a lot worse than you thought, you're going to be pretty devastated, especially if you have elderly people in your home. And we all have elderly people in our home. You know, we got parents, we got grandparents. So the point is that your window of opportunity is closing, but you still have time. Some states still have time to sit down and get what they need before it's too late. And people have shown that they have the money. You know, they just have not prepared. Because if you can suddenly go and buy 10, 20 cases worth of water, that's a lot of money right there, you know? So if you have the money to be able to do that, then you have the money to do the rest also. So I'm going to leave you with that video. And hopefully this will help you make up your mind to have a prepper lifestyle mindset, you know, because it's for your benefit. It's for everybody's benefit, for your family. But anyways, again, my name is Jose Prado. Please like this video. Please share it. Please share this information, because I have shown you this information is very important. 96 million Americans with 500,000 Americans dead. That is very important news. Hopefully people will start taking it more serious now. But again, share it. My name is Jose Prado. And like we say here all the time, always ready.
Let me ask you about the testing. Why are we starting the testing now, Governor? Because we've known this now for, about 2 months. I know there was an issue with the CDC sending the states tests and then saying, wait, don't take the tests yet. They're defective. Do you have effective tests now? Are you limited on the number of tests that you have?
Look, testing is limited. And this is, I think, Maria, one of the main issues we have, both in reality and in perception. When you wonder why people are so anxious and the fear, it's because the information they're getting tends to change, and they're getting mixed messages. And probably the single most important thing we can do substantively now is testing. And it hasn't been done well. I believe the CDC was caught flat-footed. We knew this was coming. We were watching China. You would have to be in denial if you didn't think what was happening in China was going to wind up here. CDC was not ready when it started. Number two, CDC handcuffed the states. I needed their approval to do my own testing. We have very sophisticated labs, governmental labs in this state. They didn't approve the New York labs to test for a period of time. It then even got larger. And now we don't have the ability to do it, to manage the flow in our state lab. We want to use private labs who can do automated testing, which exponentially increases the number of tests. We can't get CDC to approve the automated testing. And then to compound this issue, their messages are all over the place, frankly. You have the President of the United States stand up and say, anybody who wants a test can have a test. And then you have the Vice President stand up and say, we don't have the capacity to test. And we don't have the capacity to test. We can't say to people in this country or in this state, anyone who wants a test can have a test. It's just not true. And that's what causes the panic and the fear, and then you're off to the races. What we did here in New York is we have a protocol. I can't test everyone. We will prioritize testing. And you can't bring more people in the front door than you can let out the back door. You can't invite more people for a test than you can perform tests. So we have a statewide protocol, Maria, because we don't want people shopping from place to place. You know, I don't want someone to say on Long Island, well, I'll drive to Manhattan or I'll drive to Westchester. One statewide protocol that calibrates who should be tested with how many tests we can do. And the CDC has to allow private labs to come in, has to allow automated testing, because we don't have the testing capacity, period.
And even as the healthcare workers who are on the front lines, I mean, do we have enough beds in hospitals? Do you need to look toward the military to create more clinics and hospitals? I mean, it's already a stressed healthcare situation. We're getting a number of the active ingredients in our prescription drugs, like antibiotics, from China, and that's also going to we're expecting shortages there. So what about our hospital workers? What are you doing? What is the plan to keep them safe?
We are working on contingency plans right across the board. We do have the medical capacity, we have the number of beds we need, and we will have the medical capacity. Again, why are we doing this? Take the testing, do the containment, so you don't have to do more drastic measures.
Yeah.
You don't want to do a mass quarantine. And it's the vulnerable populations. You look at the numbers, we have 100 people, let's say in this state about. We have a handful that are in hospitals. Johns Hopkins has traced 100,000 cases. People get sick, people recover unless they're in the vulnerable population. So we have to keep that in focus, because worse than the virus right now, Maria, is the fear pandemic.
Yeah.
People are afraid. They don't know who to believe. They're not trusting their government.
Yeah.
They're getting different messages. The fear is more dangerous than the virus. The fear is more dangerous than the virus.
What can the public do, and do you have confidence that you are working with this administration to do everything you can? I know that you've had issues, you're in negotiations right now with the administration in terms of opening up your DMV.
The Man-Made Survival Show.